Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what an STD is, STDs versus STIs, differences in treatment, STD treatment and its effect on anticonvulsant medication, and promoting safe sex practices. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. STDs, or sexually transmitted diseases, are commonly referred to as sexually transmitted infections, are very common, and there are millions of new cases of infections occurring annually in the United States alone. STDs are viruses, bacteria, fungi, or parasites that are transmitted from one person to another through vaginal, oral, and anal sex. It is also possible for the infections to be passed through other forms of intimate contact, such as heavy petting. However, this form of transmission is not as expected. An STD can develop from a sexually transmitted infection, or STI, meaning the infection has led to a particular disease. For example, gonorrhea and chlamydia can cause pelvic inflammatory disease and infertility when left untreated. Not all STIs are symptomatic, or if they present with symptoms, they are mild. Having little to no symptoms can make it possible to have and spread an infection unknowingly. STDs are preventable with safe sex practices and are, in most cases, very treatable. STD treatment looks different based on the cause. Infections caused by bacteria are usually easier to treat and cure, whereas infections caused by viruses can be managed and treated, but are not always permanently cured. STIs caused by bacteria or parasitic infections are treated with antibiotics, often in a single dose. Examples of STIs treated with antibiotics include gonorrhea, syphilis, and chlamydia. STDs caused by viruses are treated with antiviral medication, such as herpes or HIV. Antiviral medication for those specific infections will keep the infection controlled. However, one will still be a carrier of the virus and have the ability to spread it, though with proper medical management, the risk is decreased. Antibiotics can affect the effectiveness of anti-epileptic drugs and vice versa. Taking antibiotics with AEDs together can lead to an enhanced seizure risk due to the interactions between both medications. This may cause alterations in the drug's metabolism and the therapy's efficacy. Comparatively, there is no significant evidence of indication that antiviral medications dramatically affect the effectiveness of anti-epileptic drugs. However, there is research that indicates that COVID-19 treatment, which is typically antiviral and immune therapies, along the use of AEDs, could potentially cause drug-related health issues such as toxicity, treatment failure, and the enhanced frequency of seizures. Suppose you contract or suspect you have an STI. In that case, it is essential to consult your primary care provider, neurologist, or epileptologist before starting antibiotics to ensure the efficacy of your current anti-epileptic medication is not negatively affected. Proper safe sex prevents the exchange of semen, vaginal secretions, and blood between consenting sexual partners. Safe sex is essential for maintaining sexual wellness and health through the prevention of contracting and transmitting sexually transmitted infections. Engaging in unprotected intercourse can put you and your partner at risk of contracting STIs and be spread when sores or rashes are present on a person during sex. Unprotected sex can also lead to an unplanned pregnancy. In the cases where an STI is contracted, unborn babies are at risk as well, since some STIs can pass from mother to baby during the gestational period and at the time of birth. Since not all STIs are symptomatic, It is important to be aware of one's sexual wellness by practicing safe sex and getting tested regularly, especially when developing new sexual relationships. Condoms and dental dams provide the best protection against infections since they are a physical barrier that prevents the exchange of bodily fluids. Condoms are made from male and female anatomy and are effective when used correctly. Other forms of barrier methods, such as a diaphragm, a soft, shallow cup that is fitted inside the vagina to block the opening of the cervix, are a good source of protection against pregnancy. However, they provide no protection against STIs. If you have been exposed to an STI, seek care from your primary healthcare provider to receive testing and appropriate treatment. In conclusion, STDs are viruses, bacteria, fungi, or parasites that are transmitted from one person to another through vaginal, oral, and anal sex. STIs caused by bacteria or parasitic infections are treated with antibiotics, often in a single dose. STDs caused by viruses are treated with antiviral medication, such as herpes or HIV. Antiviral medication for those specific infections will keep the infection controlled. However, one will still be a carrier of the virus and have the ability to spread it, though with proper medical management, the risk is decreased. Antibiotics can affect the effectiveness of anti-epileptic drugs and vice versa. Taking antibiotics and AEDs together can lead to an enhanced seizure risk due to the interactions between both medications. Consult with your neurologist if you are being treated for an STI or STD to prevent any negative interactions. Practicing safe sex is important to prevent becoming infected or having an unplanned pregnancy. If you have been exposed to an STI, seek care from your primary healthcare provider to receive testing and appropriate treatment. To learn more about STDs and their effect on epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.